It's been smoother, for sure. Yeah.
That's pretty much it. Not bad, huh?
Ooh, no, that's great.
Okay, so that's how many weeks pregnant are you?
37 and a half.
37 and a half?
Yeah.
We're going for like 45 weeks.
No, oh my God.
Just kidding, right? Yeah.
Please
so
no.
You've been seeing us, man, how long now?
Over a year.
Over a year, yeah. And you came in for, it was more like back pain, but all like back issues, stiffness, mid back. And then you already had your little ones. We started with the little one who couldn't turn his neck first.
Right.
He came in like this from like a trampoline accident, right? That was actually a scary first visit.
It was.
But he was okay.
Yeah.
And then we were taking care of you guys. Then you said, oh, what? We got another one on the way. So we're up to 37 and a half. Gotta say half. So what we're gonna do is we're gonna analyze her. The thing with pregnancy is the symptoms that usually during like prenatal care, you've got your hands can go numb really easy. They'll call it carpal tunnel. All the ligaments get really loose because the relaxin sets in. When the relaxin sets in, it's basically the body prepping to have a baby. So the pelvis opens up, the joints open up, but it doesn't just send relaxin to the pelvis, it goes everywhere. So then the neck gets looser, the hands get looser, the bones everywhere, all the joints loosen with relaxin. So it's just a hormone, it's natural. And then about 2 weeks after pregnancy is usually when we check and see how the structure changed. So, but obviously back pain bothers everyone, and we can keep an eye on the position of the pelvis. So the position of the pelvis is important because there's 4 main ligaments that attach to the uterus. 2 are in the back, 2 are in the front. So we keep an eye on those. That's why we press. Oh yeah, me and so I have gorilla thumbs, and then Dr. Jen has needle fingers. So she's got skinny, long, like painful fingers, and I have the smashers. So Thor's hammer, I guess, is my thumbs. I usually use my thumbs, yeah. But yeah, my thumbs are pretty long. It's kind of strange. But what we're gonna do is we'll go over like how we're checking you, all that kind of stuff.
Okay.
Explain where we're at. Every segment we do a little motion and movement. Sometimes we check reflexes. Well, what you can do is you can find areas in the spine where there's a little swelling and edema, where sometimes it's tender. And as we go, we also get down to the lower back. We can get right through here, and when we lean someone just a tad, we can see how the sacrum kind of gets stuck. The sacrum is this big triangular bone here, and that's where there's a ligament called the uterosacral ligament. That's what attaches directly to the uterus. So I've taken care of you for so long that I don't have to spend too much time finding everything. So we're gonna get you adjusted, and then you'll be able to get out of here. Let's start with, we're gonna release the mid back because it's super stiff. Then we'll work on the lower back. So we're gonna lay on our back head right here. So we're gonna cross our arms. This is called an anterior thoracic adjustment. I know nobody really cares what it's called, but you guys usually call it, can you do the thing where you put your fist in the middle of my back and then it just like feels amazing? That's usually what people ask. So we're just gonna roll, relax, and it just feels awesome.
Oh,
yeah.
It does.
So next thing is, it's interesting why it's important to check the neck during pregnancy is these 2 bones couple with the lower back. So if the top of your neck is misaligned, it actually tenses up your lower back. So we'll just lean just slightly here. Good. And we're gonna move one a little bit lower. This affects tension headaches. Good. Okay, come back up. So one interesting thing that we're gonna do, now we're gonna check your pelvis afterwards, just because everything can like release, your hips can release just from the top. So I'll have you lean forward for me. And as she leans forward, right side tightens up a little. So, and it's a girl, right?
Yep.
Yeah. So it's tight right through here. So we're gonna move this side of your lower back. We'll move the sacrum. String your bottom. Is this your favorite? This one's a sweet one.
It actually feels so good.
We roll, never dropped anybody. Oh, God. Perfect.
Whew.
Okay, now just lay on your back because we're gonna check the ligament. this is the bone that we moved. So if you imagine rubber band that attaches to a big old balloon here, that would be the uterus. If I could grab like a dry erase board or dry erase marker and draw on there. But then in the front, the pelvis is here and it attaches directly to the uterus, right? So you want to check the ligaments in the front. This is where it stinks. So if the right side is misaligned, usually that pulls like this, and then the opposite side is going to pull. So we always check the opposite side where we're at. That's usually where it's more tense. Perfect. Here we go. That. Got it. I know. Take everything. Perfect. That's pretty much it.
All right.
Comments? Feel pretty good?
Yeah.
Smooth pregnancy?
Yeah, it has been.
I mean, so you've been adjusted.
Way better.
How many times during pregnancy?
At least once every 2 weeks. Mostly like once a week.
This is your third little one, right?
Yes.
Were you adjusted all three?
I wasn't.
You were?
I only was adjusted at the end for like maintenance.
Yeah.
Not here, obviously. So it was totally different. Like I feel like it's been a lot different this time around.
This has been smooth.
It's been smoother
Yeah.
for sure. Yeah. And a lot of help because my lower back got really tight at the very beginning, which didn't happen with the other two.
Yeah.
So having you guys here adjusting me has helped a ton, just like with sleep and
Do hands. That's another thing. We check the hands. So what's funny is we get questions all the time. People are like, is it safe to be adjusted when you're pregnant? I was like, well, we're not going to x-ray you while you're pregnant.
Right.
There's different protocols. It's just that technique's called the Webster's technique. But everything else is just we review everything and make sure everything seems pretty safe. And then, but people are like, what happened? Like, not going to break.
No.
The way we adjust the neck too, if you notice, we're not like twisting your neck back that way because it's just a lateral kind of movement and a little movement that way. But then even sometimes we use the tools and all that kind of stuff. But that's pretty much it. Not bad, huh?
No, that's great. Thank you.
It's pretty easy, right?
Yeah.